Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Jason Alviene. Alviene is a chiropractor, and the organization is now PROFUSION CHIROPRACTIC. And I asked him last time he was on the radio show, what does perfusion mean? And it's like everything, doesn't it?
Yeah.
Perfusion, that's right.
Abundance, yes.
Abundance, that's what you said it was. So, are you feeling abundant?
Yes. Yes, I am.
And we have people who, of course, come in to our shows and they're hurting. Their legs are hurting, their back's hurting. And I always say, have you been to a chiropractic? Of course, my next thing would be, well, I have a chiropractor that you can go to. But they put it off, and I have no idea why they do that. Why do they do that, Dr. Alviene?
From what I see, the person's still capable of doing what they want to do for the day and get through the day. They're happy with that. It's kind of I'm still able to get this done and get that done, and I know I'm a little sore or this bothers me, but I'm still able to complete the task that I want to complete. When that stops happening, that's usually when they walk into the office.
And what will you do for them? So let's say they come in and they say, oh, well, my hips are hurting me. Tell me what the procedure is.
Well, the first thing we have to do is we have to go through the history. I have to find out exactly what's going on with the hips, how long has this been bothering them, and not just how long on that time. When was the first time that they noticed that they had the hip issue? Could have been 5 years ago, could have been 10, could have been 20. Because usually when you start having an issue and you start noticing something, it kind of comes and goes at the beginning. And a few years later you might get it again, and then it goes, and then it gets worse than have it, and then it goes away, because the body's always trying to adapt. But usually when they walk into the office, it's because they've stopped them from being able to do something. They've had this issue for 5, 10, 15, 20 years, and then they want to get it corrected. So usually getting them feeling better happens pretty quickly, but getting it corrected is a longer process.
And people will really keep from going that long? I mean, you said 20 years they've had problems and they don't take care of it. Why would they not do that?
You almost don't want to know. You don't want to know the answer or the work that you have to put into it to get yourself back to where you want to be or where you originally were. It's a lot of work. It's a commitment. You have to stick to the plan, get through it, get corrected, and then there's maintenance and wellness type of things that you have to continue doing for a lifetime if you want to keep it going. And you look at the way dentists work with teeth. If you're not brushing them and you're not flossing, eventually they're going to rot and fall out and they go away. But if you're keeping up with that maintenance, you have lifelong teeth. It's just something you see that going on, and that's just the teeth in your mouth. Very small area of the body. I'm working with the spine and other areas. I mean, the spine takes up a good part of your body, and it's protecting that spinal cord, that nervous system that allows you to communicate with your brain and your body.
So someone has an automobile accident, and let's say they're rear-ended, and somehow everything just goes, the wrong way. What do you do with them? How do you help them? Well,
automobile accident, that's just with any accident. That's a little different than somebody that's like they've been having hip pain and it's been around for a long time. An accident's one of those immediate traumas. You didn't have a problem beforehand. Now all of a sudden you do. The key to that is getting the right therapy over the first 2, 3, 4 months so the body can heal the best way it possibly can. When you leave it alone and you don't pay attention to what's going on with the body, you might not heal as good as you could, and then you're going to have a lifelong problem down the road with that injury. So somebody comes in with a car accident, you definitely want to do the evaluation. Make sure it's safe for them to be able to move forward with treatment in chiropractic, going through MRIs to make sure there's nothing broken or there's no damage that they need surgery for. And then if it's the case, you go through the care plan, get them strong, and get them back to being able to be in themselves so they can function.
Right, and there are people, though, who it seems that this has happened to them, and then it brings on other problems. So they went in there and maybe their back, their neck, but now all of a sudden their hips, because when someone has an accident and they get up and they feel fine, they may not be fine.
Correct. Oh, I've had people that walk into my office, and then we did X-ray or MRI, found out that they had a fractured vertebra. And it can be fractured and still be intact in the right place, so it's not causing an immediate problem, but there's an instability there that if it shifts slightly, it could cause nerve damage, and they may need surgery or that. So it's always good to get checked after you've been in an accident, because even at very low pressure forces, your head whipping back and forth, get checked. Whether it's with a chiropractor, whether it's at an urgent care, wherever you go, get checked to make sure everything's okay with your body, so you don't have an issue 2, 3, 4 weeks down the road.
My guest is Dr. Jason Alviene, and he is a chiropractor, and he has a chiropractic, I don't want to call it a business, a practice, a chiropractic practice, which is PROFUSION CHIROPRACTIC. And he is located in Boca Raton, and he's someone who thinks way out of the box. I'll say that for him, because he has lots of other things. By the way, it's off the subject, but I read your book. I read the book about how to write a book. And you know, there are a lot of things in there that I can use that has nothing to do with my writing a book.
Correct.
Yeah, I mean, it was really very good. I mean, I just thought I'd whiz through it, but even though it's very small, there are lots of very good tips that I'm going to use.
Oh, good.
I didn't expect that.
Good. I'm glad that came out.
It did.
Yeah.
You knew that, right?
Yeah, because I put together the manual for myself so I could finish writing a book, and it was more about structures in place to make sure you did it.
Right, exactly. It was like procrastination. You went off the procrastination.
Yeah.
line.
It's like
I know. I saw that. so that. But anyway, getting back to this. So when you talked, though, we talked about sports medicine, because that's something you feel very comfortable. Actually, you teach. Where do you teach, and what do you do?
I teach with Kaiser University in their sports medicine program.
And they have a sports medicine program. Why do we have a sports medicine program?
So this particular program is designed to help people with exercise after they've gotten to a point where they don't need physical therapy or that type of placement anymore. It's to be able to more of a wellness type of exercise. So if you're thinking of personal trainers or corporate wellness or coaches, that's the type of person that comes out of this program to be able to help. But it's also a great program for a stepping stone to go on therapy school, chiropractic school, even if they wanted to go on to be a DO or an MD. It's really a good program to be able to move down that avenue. I have a student that recently went into a physician assistant program that went this, and it's great to be able to see somebody use it as a process to move on to the next level.
So if someone wanted to hear you teach and go there, you teach it once a week? How often do you teach?
I'm there teaching classes two mornings a week.
Okay, so that's a very good thing, and you, I'm sure, have people coming through there and becoming chiropractors.
Yes, one student in particular that I can think of that started the program with us back in 2009, all the way through the same chiropractic school I went to, now has his own practice in North Carolina.
Very nice.
So it's just one of those, you got to watch this person grow through the whole process. It was neat.
Right. And I don't know if I asked you this before, but how early should people go through chiropractic? I think, did we talk about babies that were just first born, or did we cover any of that?
I don't remember if we covered that, but
right,
getting checked, that's what it's about. It's not always needing to be adjusted or to be treated. It's about getting checked to make sure everything's in an optimal place for whatever body's out there. Now, if anybody out there has ever been before as an adult, completely different process with a baby. Looking at their spine and their bones, they're not fully formed bones yet. Most of it is cartilage. So it wouldn't be the same type of adjustment. It's a very light, low force type of procedure, almost like or like a vibration type of movement onto the vertebra if it needs to shift, but it's not much. And what's really neat about a child is they don't have any skepticism or any of that towards it.
No fear, right?
But they don't have a judgment. So when you go to it's either going to not. They're not going to make this preconceived notion on maybe this will work or maybe this won't. They don't know.
But the mother there will be thinking that, right?
The mother there will. And that's where working on the child and being able to move something back to where it needs to be, and then the mother noticing immediate changes in the child. They're like, wow, that's amazing to be able to see that.
Well, when you think of it, that little body's coming through a channel. I mean, it's coming all the way through. Must be a lot of stress and strain. I never really thought about it in a sense until we started talking about this.
Oh, and whether it's through the birth canal or a C-section, the head gets pulled and shifted, and that pulls on that neck, that cervical spine. And one of the things that we've noticed is when somebody's doing breastfeeding, they might only be able to feed from one side because the baby won't turn their head to the other. And that's usually a very simple process where you find the C1 vertebra all the way at the top is kind of stuck slightly out of place. You do the procedure and you can actually watch the baby just physically turn their head to the other side while it's happening.
That's beautiful.
Yeah, it's children, they don't need to get it time. Might be once every 2 months, 3 months, depending on their body if they need it. But they have such a new body that one adjustment usually takes care of the issue.
I was thinking of my daughter-in-law who had triplets, and they each had to come. Can you imagine what that was like for those children?
Yeah, just being inside that womb and pushing and growing in different pressures. Yeah, they're gonna need adjusting.
Right. Yeah.
For sure.
I never think about that, but that's right. Well, so maybe some of the things that they experienced, you don't really think that could have been from what happened, because it seems like it's so simple, as you're saying. You just do a few little things and then they could be on their way.
Yeah, all these conditions that are out there, whether it be neck not being able to turn one way, or they're having a ear infection, or they're having colic, or any of these things, we as chiropractors don't treat that specifically. We treat the spine, and we treat the nervous system on the way it comes out of the spine. And if we get that back in place and the signals are able to pass through the spine to the tissues, you can notice things like colic going away as a secondary condition. You can see things like ear infections start to clear up. And it's not that we're treating that particularly, we're just treating the spine. And if that clears up along with it, it's wonderful to see.
When you think of the spine, right? The spine is backbone, as they say, the backbone of everything, right?
And it protects your nervous system. Your skull for your brain, the spinal column for your spinal cord, and then the nerves all leave out through there. So you want to make sure that stays as much intact as possible.
Oh, that's really well said, and I'm very happy that you're here to help us with this. And he's been on the radio every week for us. He's 6:30 in the morning at WSBR, and his name is Jason Alviene, Alvienne, and the company, his practice is called PROFUSION Chiropractic, and the phone number to call is 6344, right? 6344. Again, 561-504-6344, and the website is PROFUSIONChiropractic.com. So when we talked about this once before, people who get hurt, and I told you this, that the first thing they do is they put heat on because it feels better. But you were very good when you said, no, you're going to use ice for at least how long? A day or 2 days? And how often do you put it on? Someone said every 20 minutes, or how do you do this?
So with the ice, basic rule of thumb is 20 minutes on, 20 minutes off. So you put the ice on the area for 20 minutes and then take it off and give it a rest for about 20 minutes. The main reason that's done that way is there's a lot of those gel packs out there that get really cold in the freezer. So if you put it on any longer than 20 minutes, you run the risk of frostbite. So that's where that 20-minute on, 20-minute off goes. However, that 20 minutes is key. If you take it off too early, the body's response, you'll be at a certain stage where it'll actually make it hurt more. Because when you first put the cold on, you end up going through that stage where you start feeling it burning from the ice before it goes numb. You have to wait till the stage. Otherwise, you'll actually hurt more because you'll have the burning from the ice and you'll still have the pain there. So that 20 minutes is really important. You want to feel it get numb. So this way it can actually help the decrease in pain and the swelling.
So if you hurt yourself, you don't really want to get in a hot bathtub.
Most likely not. No, you don't want to get in
But
there.
that's usually what people will want to do.
Well, within the first 72 hours, typically from when you hurt yourself, is you don't want to get too much on the heat, about 72 hours. But I always recommend if you're injured, get checked, because if it's something else beyond that, you want to know right away.
Yeah, but ice really is a great usage of something that's just natural, because
Yeah.
I have really had that where I just put ice and then it just goes away.
Oh, yeah.
But what does the ice do? What does it do into the muscles? And actually
So
explain that.
when you first put the ice on there, the body's going to see it as an issue where it's going to make the blood cold. So everything starts to constrict in the area. So the blood leaves the area and it starts to cool down, the nerves start to slow down, everything starts to slow, and it starts to contract. Once you start getting to a certain point where the ice on long, the body's going to go, hey, it's getting too cold. We need to send blood back to the area to warm it up so it doesn't get damaged. And then you get this rush of blood through the tissue, which brings nutrients and everything to the area, but it's already in a numb stage. So you get nutrients and everything coming to the area, and you decrease the pain.
And then what does the heat do when you finally put that on?
So the heat later, after you get through the process of getting the swelling and everything out there, it just calms everything down. Heat is a sedative, so after you have it on there for a long period of time, the muscle starts to relax, the tissues start to relax, and it calms everything down. If you're laying outside in the sun, you don't want to be up jumping around. You want to lay down and relax because you don't want to overheat. So everything in the area starts to calm down and cool off.
But you also said we were talking about heating pads, and you said it should be water. You said it should
Yeah,
be
moist heat.
moist
Yeah.
heat.
When it's an electric heat, so if you're using a heating pad that you plug into the wall,
Yes.
and it's got an electrical coil going through it, it doesn't have any moisture in there. So when you have that heating pad on your tissue, it's going to cause moisture to leave your body, and it dehydrates the area, and it can cause more muscle spasms later after you take the heat off, which creates more discomfort.
But you don't want, if it's an electrical heat pad, you don't want to put any water or ice on that.
No, you want to get
special
you
one.
want to get a heating pad that's for moist
I
heat.
don't want people to hear
that
this
you
and
might,
say, I'm going to put some water on it.
Yeah, that you plug it in, and then the actual heating element of the pad has like a sand or a gel or something in there versus an actual electrical coil.
Okay, that's all good advice. And it seems simple, but people have always said, do I ice it? Do I heat it? And you talked about that on our show before, and that's really very, very smart. All right, let's just go through the body in a sense, because when you're a chiropractor, and we talked about this, you have to learn about the whole body.
Mm-hmm.
What happens with the feet when you're a runner? Because you are a runner.
Yes.
And if you're a runner, can't that cause leg and hip problems?
It could.
Yeah.
It could.
But
So if the body's functioning correctly, the foot's functioning correctly, knee, hip, back, and it's all going well, you can run for a long period of time without it causing any issues.
it's not the pounding does not hurt anything.
The pounding won't hurt anything if you have the proper shoes and you have the proper alignment of the feet, the knee, the hip, the back. Everything's running in proper alignment, and you a certain point to where you can run for long periods of time. You can. This is why so many people are able to do half marathons and marathons today, because they're training for it, but they're also making sure that they're getting the right recovery. They're doing their foam rolling type of techniques, which help loosen up the muscles. They're getting massage. They're getting chiropractic to make sure everything's in alignment. Physically, they're doing the recovery portion. The people that don't tend to get injured, especially if they're not using the right equipment, or if their foot's not moving right, knees not moving right, and hips not moving right, you're going to end up with a problem.
And you told me that you yoga early on. I mean, you were a massage therapist.
Mm-hmm.
And do you do yoga now?
I don't teach it, but
That's what I'm saying.
I'll go to
You
yoga
do.
classes. Yes, I like doing more of the relaxation type of yoga. That's more towards the meditation relaxation yoga versus that would be like the hot yoga out there. Not
Okay.
that there's anything wrong with those.
Right.
It's just my preference. I'm doing running and other exercises. I do my yoga. I want it to be more about meditation and recovery for me.
And you do it.
Yes. Yeah, one of my in yoga. It's a wonderful. Most of it's done on the floor, whether you're laying on your back or your belly, and you put your body into some stressful situations where you add a little bit of extra pressure to the body. You can feel pulling, not to where I feel I'm doing a workout, and I relax and breathe through it.
And so do you advise your patients to do yoga, or what do you advise them to do? Swimming, or what would you like them to do?
I try to figure out where they want to go.
Ah.
That's going to be a big part of it. I tell somebody to do this exercise if it's not going to be beneficial to them. Like, they're not going to do it. So we try to find out what is going to make them happy and also what's going to help them the most. And we try to blend that together. So some patients will be doing yoga, some will be doing Tai Chi, some will be swimming, some will just meditation. It really depends on where they are.
So you sound to me more like a counselor. I mean, you're like a psychologist all wrapped up in one, right? You're the chiropractor. Really try to analyze a lot of experience yourself, especially if you've been a massage therapist. That is a unique situation. I have a massage therapist, and they have to know so much. A good one. I'm not talking about people in these little studios, but people who really take this seriously, which you did, and you did well.
Mm-hmm.
And that's what encouraged you to be a chiropractor, wasn't it?
Yeah. When somebody walks into the office and they come in and they have a problem, if I focus on that problem, I'm just seeing them as a problem. So I don't focus on that. I focus on them as a human that has an issue right now. So we have to figure out where they are as a human so we can help out that issue that they're currently going through. A problem or an issue is just something can be temporary. But them as a human, that's really where they are.
I never heard that before. That's because that's right. They come in and they're a problem, and you don't want to just help them as a problem, help them as a human being.
Mm-hmm.
And what else do you have? And I'm sure that they talk a lot too, and there's some things you can't solve for them.
No, I can't solve everything. But the point is I can listen to them, figure out where they are, and if the problem that they do come in with, it's something that I know I can, referring them to somebody, I do.
All right, and we haven't touched on shoes. We talked about running or just doing other kinds of things, bicycling. How do you know when because there aren't a lot of places you go nowadays where someone will take the time, measure your foot, and talk to you. These are just salespeople who are selling you. How do you know what the proper footwear is?
Well, there's so much out there. One of my favorite places to go around the area here in Delray Beach is Fleet Feet. They do a virtual scan of your foot. It gives you the actual size of both feet. Some one foot's always bigger than the other.
Oh, really?
And then based on what your foot is, you try on a bunch of different shoes that are for your foot type. And I always, especially when it comes to running shoes, it needs to feel broken in the store. Huh. If you're testing them out in the store and you're like, oh, I think I could break these in, they're not the shoe for you. Breaking them in on running, you can't break those shoes in. You got to have them immediately like they are supposed to, like you've had them for years.
Well, a personal story is I had old sneakers I loved, and they were great, but they just were old, and people said, oh, you have to get new sneakers. So I went to get them, and unfortunately I went and I got shoes, and I don't run. I was walking. Mm-hmm. And I had them, and all of a sudden I had a problem with my foot. I never had a problem before, and I went to a podiatrist. The podiatrist fit me with all sorts of things, with insoles and all, and I spent some money to do that. And what I did is I went back to my old shoes, and all of that disappeared. Now, so it must have been just like what you said. Those shoes were just not right for me.
No.
They were causing me something to just be out of joint or do something. So I really warn people, just like what you said, make sure they're comfortable. And if you're a runner, use runner shoes. If you're a walker, use walker shoes, right?
Yeah.
I mean, I don't even know what the difference is.
Yeah, there's many different types out there. So get the shoe that's appropriate for the event or the activity that you want to do. If it's trail running, if it's trail walking, hiking, running, there's all these different things that you can be doing. If you're going to be a CrossFitter, you want to get the right shoes for that. So it really depends on the activity.
And how are they designed? Why are they different? I mean, how are they?
Because the shoe is built for the activity that you're going to be doing. Yeah, so they put different pressures and different soles in different areas for that particular activity.
I've never had anyone discuss this with me. You're always good. You know, and it's interesting. I have to tell everybody, Dr. Alviene and I never discuss what we're going to talk about. I just know he's so darn smart that I can almost ask him everything. So I go through my book. What am I going to ask him? What am I going to ask him? And you always meet my expectations. But Dr. Alviene, thank you very much for being here. The phone number to call him is 561-504-6044. Is that right?
6344.
What did I say? 65? I meant 6344. 561-504-6344. Got that, everyone? Okay. And then the other thing is it's PROFUSION.com. So please do call him and just go have a chiropractic fitting and see how that goes, right?
Yeah.
Even if you don't have anything wrong.
Always do. Let's talk. Let's figure out if it's going to be a good fit, and then we go from there.
And if you need a speaker, I'm sure he'd be glad to do that too.
Yes, 100%.
Thank you so much, Dr. Alviene.